Hi, I'm Ariana Song, and I'm here today with Dr. June Liang, my mom, and also a family physician in the Fairview system. How are you?
Good.
Can you tell me about the process? Like, what happens when a patient is admitted into a hospital, like, say, Abbott Northwestern?
I'm not sure exactly in North Abbott Hospital how the process works, but I think they're very similar. And then there are different hospitals in the Minnesota, and they belong to roughly about four system. And as you know, there is Alina system,
Mm-hmm.
which that's I think that's where the Northwestern Abbott Hospital that you're
Mm-hmm.
volunteer over there.
Yeah.
And there is a Fairview system in which they have their hospital,
Mm-hmm.
and Park Nicollet is another system that owns their hospital also, and then the other big one is a House Partner. And as far as in the whole Minnesota, that's about roughly all the major health system we having over here. Patient admitted to a hospital roughly by, I would say, two major categories.
Mm-hmm.
One is they are admitted through the emergency room in the hospital,
Mm-hmm.
and most that kind of a situation is that patient get into the emergency room for various symptoms or illness or discomfort they having.
Mm-hmm.
They were evaluated at the emergency room, and then they were admitted to the hospital, and a very small percentage of that based on their conditions. And so when you are evaluated in the emergency room, and pretty much you're determined that it's okay to safely to send you home to recover, or you needed to get into the hospital.
Mm-hmm.
Once you get into the hospital, and depend on which area of the hospital you're admitted to, and based on your condition. For example, you could be admitted to the medical surgical floor,
Mm-hmm.
in which that's pretty much most people will be admitted to for various kind of illness.
Mm-hmm.
Or you were admitted to the specialty unit, like if you have cardiac condition, for example,
Mm-hmm.
you have a heart attack, or you have cancer condition and
Mm-hmm.
you'll be admitted to the oncology floor, or if you have a mental health problem, you'll be admitted to a specific unit called a psychiatric unit.
Mm-hmm.
And if you're a baby, roughly that's under age, I would say 21, or some
Mm-hmm.
places are 18, and
Mm-hmm.
then you'll be admitted to the pediatric floor.
Okay.
And if you're a woman having a baby, of course you'll be admitted to the labor delivery.
Okay.
So those are roughly those are like a major places. And if you need a surgery right away, you go into the OR. And
Mm-hmm.
but after you had your surgery, then you come out to the medical surgical floor for your recovery. And exactly what happened, for example, most common, if you're admitted to the medical surgical floor for whatever condition,
Mm-hmm.
you get into there from emergency hospital to the we call the hospital world,
Mm-hmm.
and then generally people take you by the stretcher or bed or transfer or
Mm-hmm.
whatever, and then the nurse will kind of take the information data to get you in, and then there is doctor in the hospital will coming to interview you, to evaluate you, and then to determine a proper treatment for you, and then the things to get carried on from
Mm-hmm.
there. The how long you stay in the hospital or what kind of things happening all depend on what kind of diagnosis you're having, or what kind of treatment you probably will
Mm.
need or going to need.
Okay, so how long on average do people stay? Or are most people sent home right away?
That is really not necessarily have any ballpark time, but really depend on your condition. And
Mm-hmm.
nowadays, most acute illness you probably will spend in a hospital average is about 1 to a week type of situation.
Mm-hmm.
But some condition can lasting much longer. And if you are older and you are have complicated the situation, or if you are a cancer patient, you might spend there a couple of weeks. It depends on
Okay.
the overall trend is that to make people stay in a hospital as short as possible. and there is a one clear area where that you pretty much know how many days that people are going to stay in a hospital
Mm-hmm.
is a maternal patient. Means that a mom who's just had a baby,
Mm-hmm.
and average is 2 days.
Oh, okay. So it's pretty short. So you mentioned how there are four main health care providers, right?
In Minnesota,
In
you're right.
Minnesota. And so does the system change in every provider, or is it mostly the same throughout?
What you mean change in?
Like, do they have different processes or ways how they function?
I think in Minnesota, pretty much their system are pretty much the same. And
Mm-hmm.
I would say if you're talking about the patient in admission, how it works, and how it discharged, I think throughout the nation they're very similar. They're pretty much
Okay.
the same. And in Minnesota, there is a unique system called a Mayo Health system,
Mm-hmm.
and you probably know about that. And Mayo system, I think, has a tiny little bit of different sort of work process because they are getting referral or request from all over the world, from
Mm-hmm.
everywhere. So, and their process might be a little bit different. Namely, once you get into the hospital world, it's pretty much the same. But for
Mm-hmm.
male patients, a lot of them are kind of coming from outside. They most time they live in the hotel
Mm-hmm.
in that male city, so
Mm-hmm.
to speak, and sometimes their admission can be a little bit lengthy waiting before you can
Oh,
get to
okay.
there.
Yeah, because it's a really famous world-known hospital, isn't it?
Yes, and it is as far as research and clinical care and everything. So, and but they do have something unique they can offer in
Mm-hmm.
that where you're not necessarily getting it from other places.
Has the recent enactment of Obamacare um, affected you in any way, or do you have any ideas on how it will affect you?
I don't think that's really happening yet, but we were talking about it. I think in the process of preparing for it, and depending on the different specialty, it might have a different impact. I think the big thing is that I think we still don't know who is going to pay for the cost of that right now. The
Mm-hmm.
Obamacare is going to starting in 2014, so next
Mm-hmm.
year we might have a little bit more information or feel or reality for it. And the bottom line is that yes, you definitely will have more patients to access the system where
Mm-hmm.
already existing. And the question is that the shortage we're predicting about primary care or certain type of access issues is
Mm-hmm.
going to be true or not. I think that depends on the region
Oh, okay.
of the country.
So do you think overall it's going to be more difficult or more helpful in the end?
Depend on which part you're standing in talking about in the terms
Like
of
for primary care?
for primary care. I think you if you just thinking about it, there's going to be more demand and more people need the care. You probably will feel yes that is good for primary care because you will have more
Mm-hmm.
numbers, more patients in terms of problem part you can foresee in some area that when you don't have enough either primary care doctor or specialty care that then you are not necessarily able to have the care that you deserve or you want
Mm-hmm.
to because you just simply cannot get it.
Oh, okay. Well, thank you for your time. We really appreciate it.